The imposition of curfew measures to curb the spread of COVID cannot be excluded in France if infections continue to rise rapidly. This according to health officials. France reporting more than 12,500 new cases on Sunday. The third day that the tally has gone above 10,000 is coming as the rapid spread of the more contagious Delta variant leads to a jump in new infections. In the meantime, tens of thousands of people protested over the weekend against new government measures which include an obligation for French nationals to bring in a health pass for most public places and for health workers to face mandatory vaccinations. The health pass will be given to those who are fully vaccinated against COVID or have proof of a negative test taken within the last 48 hours. Dr. Cédric Hansen is Deputy President of the Global Health Alliance and joins me now. Thank you very much for your time. The government proposing these new health measures today at a cabinet meeting, but are they enough?
They are a part of what is very useful to control the spread of the virus among the population, indeed. But the high level of attention of the public to follow as well all the barrier measures and social distanciation are part of the fight against that pandemic in France and all over the world. So absolutely it is important that we remain focused on the fight during the holidays, although this is a time and period where we enjoy to be among friends, but we should be very, very cautious.
What other measures should be put in place by the government, especially as we're now looking like we're facing yet another wave thanks to the Delta variant?
Well, it is important that we focus the actions on where the virus is disseminating. Actually, the spread of the Delta variant is a picture of the transparency or the leakage of the barrier measures among the population. And one very simple measure would be to spread your hands around you. If you spread your hands and you touch someone, that means the density of population around you is too high and you should wear a mask, being vaccinated or not. And be very cautious on using hydroalcoholic gels as soon as possible. If you don't touch people around you, that means the density is good enough. And if you're vaccinated, then you are not compulsory to wear a mask. Those are simple messages, and we should develop more simple messages such as this one, because it is important that at the individual level, we fight efficiently against the spread of the virus.
And also ventilation is key, and it is extraordinary. We're 17 months into this global pandemic and there's still many offices of businesses where you walk in and you can see that the ventilation is not what it should be.
Well, that's another part. It is very important and of utmost importance that every individual take into account the fact that the disease is invisible. So we are fighting against an invisible threat, and we only confuse that it is a threat only when it is visible, so when people have symptoms. But actually, if you are asymptomatic, that you have no symptoms, you may spread the virus around you. So it is very important that in workplaces, anywhere, you are still aware and pay attention to respect all the barriers measures. The fight is not over. It is still ahead of us.
Dr. Hansen, thank you so much for your time.
You're welcome.